Welcome to the Module 7 video of the PSW NACC certification exam. In this module, we'll be going through some questions for care planning, restorative care, documentation, and working in the community. Question 1. What is the primary purpose of a care plan? A. To provide a rigid set of instructions for the PSW. B. To ensure that all clients receive identical care. C. To serve as a guideline tailored to meet the client's specific needs. D. To track financial expenditures related to care. Care plans are not rigid, rather they are adaptable to changing clients' needs. For option B, care plans are also individualized and they are not identical for all clients. The primary purpose of a care plan is to create a personalized guide that addresses the unique needs, preferences, and goals of a client. In option D, while financial tracking is important, it is not the focus of a care plan. The key features of a care plan are individualized care, which focuses on the client's medical, physical, and emotional needs. It also has the feature of the communication tool where you're expected to provide clear instructions for the care team. It is also goal-oriented because it aims to promote health, comfort, and independence. So, with the options we have, the primary purpose of a care plan is option C. It will serve as a guide tailored to meet the client's specific needs. It ensures that all healthcare professionals, including personal support workers, provide a consistent and coordinated care while respecting the client's individual requirements. Question 2. A PSW is providing care for a client in the community. What is the PSW's responsibility when family members are involved in the care? A. Avoid involving the family in care-related tasks. B. Communicate clearly and collaborate with the family. C. Allow the family to make all decisions without consulting the care plan. D. Focus only on tasks assigned in the care plan and avoid family interaction. In option A, avoiding family involvement can actually hinder effective care and create misunderstandings. When family members are involved in a client's care, the PSW's role includes fostering clear communication and collaboration in order to ensure that the client receives a holistic and consistent care. For option C, decisions should align with the care plan, ensuring professional input while incorporating the family's insights. In option D, focusing solely on assigned tasks may lead to missed opportunities to enhance care through family collaboration. With the options we are given here, when the family members are involved, the responsibility of the PSW is option B, to communicate clearly and collaborate with the family. This approach respects the family's involvement while maintaining adherence to the care plan and the client's needs. The PSW's responsibility with family members includes communication, where they can share observations and updates about the client as appropriate. It also involves education, guiding the family on care techniques when necessary. It involves support, where you address the family concerns empathetically while maintaining professionalism. And then boundaries, following the care plan and informing the healthcare team if adjustments are needed. Question 3. What should you do when a client complains to you about a home care agency's policy? A. Distract the client. B. Inform your supervisor about the complaints. C. Advise the client to speak to your supervisor. D. Ignore the client's complaints. Distracting the client does not resolve the issue and can even make the client feel dismissed. The best thing to do is to involve your supervisor by informing them about the complaints, because this will ensure that the complaint is escalated to the right person who can address or clarify the agency policies. For option C, while this seems reasonable, it places the burden on the client instead of ensuring that their concerns are addressed promptly. And option D is totally unprofessional and can damage the trust and rapport with the client. So in situations like this, option B is the best option. Your role is to listen attentively and act as a bridge to ensure that their concerns reaches the right authority. So you inform your supervisor about the complaints. Question 4. What are the 3 major causes of fire in a home or long-term care facility? A. Smoking, dressing, and electric blankets. B. Electric kettles, heaters, and televisions. C. Unsafe smoking, faulty electrical equipment, and cooking accidents. D. Crockpots, hot water bottles, and smoking. We'll begin with option C here. Unsafe smoking includes smoking in bed or improperly disposing of cigarette butts, which can easily ignite materials like bedding or furniture. Faulty electrical equipment like damaged wires, overloaded circuits, or malfunctioning appliances can lead to an electrical fire. Cooking is the leading cause of home fires, particularly when food is left unattended on the stove or in the oven. So these are the 3 major causes of fires in both homes and long-term care facilities. Question 5. You are about to document on a graphic sheet. What information would you put? A. Respiratory rate and heart rate. B. Anxiety level between 0 to 10. C. The percentage of food a patient eats during the shift. D. The numeric pain scale. Respiratory rate and heart rate are usually documented in a vital signs section and not the graphic sheet, except you're tracking them at regular intervals, and this is not the job of a PSW. In option B, while this may be important information, it is more often documented in narrative notes or in a specific mental health or pain assessment section. Anxiety levels are not documented on a graphic sheet. A graphic sheet is typically used for tracking quantitative data and frequently observed vital signs or patient activities. The things that can be recorded include the percentage of food intake, that is, how much a patient eats during the shift. This is a typical entry on a graphic sheet as it will provide a daily tracking of the patient's nutritional intake. For option D, pain levels are often documented separately in the pain assessment chart or section rather than a graphic sheet. So our answer here is option C. The percentage of food a patient eats during the shift is what is documented on a graphic sheet. Question 6. What is the correct time that you need to record using the 24-hour clock when documenting for 12:30 a.m.? A. 12:30. B. 12:30 a.m. C. 0030. D. 0130. In the 24-hour clock, times are recorded from 00:00, which is midnight, to 23:59, which is just before the next midnight. So with respect to the question, our answer is option C. Question 7. The best method to identify a resident of a long-term care facility is to A. Use the identification bracelet. B. Call the person by name. C. Have the person tell you their name. D. Check the laundry label on their shirts. Identification bracelets are commonly used in healthcare settings, including long-term care facilities, to ensure the correct identification of residents and to avoid errors such as giving medication to the wrong person or performing the wrong procedures. For option B, while this can be useful in certain situations, it may not be reliable if the resident has cognitive impairments or memory issues. Option C may not always be accurate, especially with residents who have difficulty with memory or cognitive functions. Option D is also not a reliable method of identification because the labels can get mixed up or removed. So the best option here is option A, using the identification bracelet to identify the residents. Question 8. Which of the following is an essential component of accurate documentation? A. Using vague terms to describe events. B. Including personal opinions about the client. C. Recording facts and observations objectively. D. Skipping non-critical tasks in the reports. Accurate documentation is a critical aspect of a PSW's responsibilities because it ensures that client care is clearly communicated among team members and maintains a legal record. The essential components of accurate documentation includes objectivity, clarity, completeness, and timeliness. So, with respect to the options we have, the answer we'll be going with is option C. Recording only facts and observed information without personal opinion or assumption is a component of accurate documentation. Also, clarity, where you have to avoid using vague terms and use precise language instead. For completeness, you ensure that you include all relevant details, even if they seem minor. And then for timeliness, documenting care as soon as possible after it is provided is very, very important. Question 9. When a PSW tells a client everything will be okay, what is he or she doing? A. Reassuring the client. B. Preventing the client from expressing their feelings. C. Solving an emotional issue for the client. D. Creating stress for the client. Reassurance to help the clients feel calm and supported is very, very important, and this is a common approach to provide the comfort that they need, especially in situations where the clients may feel uncertain or anxious. Looking at the other options, options B, while reassurance is given, it doesn't stop the clients from sharing their emotions unless the PSW dismisses or interrupts their concerns. So it is important for the PSW to also encourage open communication in order to allow the clients express their feelings. In option C, reassurance does not solve emotional issues, it only provides temporary comfort. Addressing emotional challenges often requires a more in-depth communication and support. In option D, reassurance is meant to reduce stress and not create it, so this is definitely not the correct answer. When a PSW tells a patient everything is okay, what he or she is trying to do is to reassure the client so that it can help them feel calm and supported. Question 10. When working in the community, a PSW notices a client has not been taking their prescribed medication. What should the PSW do? A. Scold the client for non-compliance. B. Adjust the medication schedule for the client. C. Report the observation to the supervisor or appropriate healthcare professional. D. Ignore it and continue with the care plan. For option A, you definitely cannot scold the clients for non-compliance because this is not part of your purview. Adjusting the medication is also not a responsibility of the PSW. The PSW should never attempt to modify medication schedules or even reprimand the clients because they are not authorized to do so. The best thing to do is to report the observation to the supervisor or the appropriate healthcare professional. If a client is not taking their prescribed medication, this could lead to serious health complications, so you want to be sure that you have escalated this to the correct authority, which will be your supervisor or the healthcare professional. In option D, ignoring the issue is neglecting the duty of the PSW to advocate for the client's well-being. Advocating for the client's well-being is the primary duty of the PSW. So with respect to the options we have here, the best thing to do is option C. Report the observation to the supervisor or appropriate healthcare professional. Question 11. Identify the medical abbreviations. I'll just go on to show what the abbreviations mean. So, I&O means intake and output. It refers to the measurement and documentation of a patient's fluid intake and output, and this is often monitored in healthcare settings. ABD is the abdomen, that's the abdominal region of the body. The H is for hour, and it is commonly used in time-related contexts. TPR is temperature, pulse, and respiration. This is the measurement of vital signs, including body temperature, pulse rates, and respiratory rates. LUQ is the left upper quadrant, and this is one of the 4 quadrants of the abdomen. It is often used to describe the location of pain or physical findings. Question 12. Passive range of motion exercises primarily prevents A. Muscle atrophy, B. Pressure ulcers, C. Joint contractures, D. Muscle spasms. Passive range of motion exercises do not involve muscle contractions, so they do not prevent muscle atrophy. Active exercises are required to maintain muscle strength. Pressure ulcers are caused by prolonged pressure on the skin, and they are prevented through proper positioning, frequent repositioning, and skin care. However, a passive range of motion exercise would not prevent pressure ulcers. The passive range of motion exercise involves moving a joint through its full range of motion without the patient actively using their muscles. These exercises are essential in preventing joint contractures, which can occur when the connecting tissues surrounding a joint shortens or tightens due to lack of movement. Contractures can lead to decreased mobility and pain. Muscle spasms may be alleviated by passive range of motion exercises, but it is not primarily intended for their prevention. So with respect to the question, our answer is option C. Passive range of motion exercises prevents joint contractions. Question 13. Which of the following is a key principle of restorative care? A. Encouraging independence in daily activities. B. Providing constant assistance to the client. C. Avoiding involvement of the client's family in care planning. D. Focusing solely on physical recovery. Encouraging independence empowers the clients, boosts their confidence, and helps improve their quality of life. And that is the primary goal of restorative care, to help the clients regain and maintain their independence and functional abilities to the greatest extent possible. It focuses on promoting autonomy, supporting self-care, and involving clients actively in their care. For option B, this can create dependency and hinder progress in regaining skills, so that's definitely not the answer. Option C is beneficial as they play a crucial role in providing support and understanding care needs. In option C, the reverse is the case because when you actually involve the client's family, it plays a crucial role in providing support and understanding care needs. For option D, while physical recovery is important, restorative care also addresses emotional, mental, and social aspects of recovery. So our answer here is option A. The key principle of restorative care is to encourage independence in daily activities. Question 14. Footboards are placed at the foot of the mattress to prevent A. Normal alignment, B. Pain, C. Plantar flexion, D. Plantar extension. For option A, normal alignment is actually promoted and not prevented by footboards. Pain is not directly addressed by footboards, although preventing deformities may reduce future discomforts. Plantar flexion can result in permanent deformities and hinder mobility, and this condition is a result of prolonged bed rest without proper support. So footboards that are placed at the foot of the mattress is used to prevent plantar flexion which occurs when the foot points downwards, leading to a condition called foot drop. In option D, there is no clinical term known as plantar extension. So with respect to the question we have here, footboards that are placed at the foot of the mattress will help to prevent plantar flexion. That is option C. Plantar flexion is a result of prolonged bed rest without proper support, causing the muscles and tendons to contract and weaken and make it difficult to flex the foot upward. So it causes what is known as the foot drop. Question 15. Grooming, mobility, and bathing are examples of A. Communication skills, B. Activities of daily living, C. Cognitive functions, D. High-level needs. Communication skills involves verbal and non-verbal interactions, and it doesn't have anything to do with physical self-care tasks. Grooming and bathing are considered activities of daily living because they refer to the basic self-care tasks that individuals perform daily to maintain their health and well-being. Cognitive functions relate to mental processes like memory, reasoning, and problem solving, while high-level needs refer to advanced psychological or emotional needs and not the basic care. So our answer here is option B. Grooming, mobility, and bathing are examples of activities of daily living. Question 16. Mr. Mark asked you to perform a function which extends beyond the scope of your training and responsibility. What should you do? A. Advise the client that you are not trained to perform that skill and report the request to your supervisor. B. Call a co-worker and ask her how to perform the skill. C. Ask Mr. Mark to tell you how to perform the skill. D. Perform the function with extra caution. As a personal support worker, it is essential to operate within the scope of your training and responsibility. So performing a task outside your training can put both you and the client at risk. So in this scenario, it is better to advise the client that you are not trained to perform that skill and then go ahead to report the request to your supervisor. Calling a coworker or asking the client how to perform the task does not ensure safe or professional care, and performing the function, even with caution, could lead to harm or legal consequences if something goes wrong. So the best option is to advise the client that you are not trained to perform that skill and then report the request to your supervisor. Question 17. What should the caregiver review to obtain information about a client and the care they need? A. Their medical charts. B. Their nursing care plan. C. The staff assignment sheets. D. Their input and output record. For this, we'll be going with option B. The nursing care plan is a comprehensive document that provides vital information regarding the client's health status, specific care needs, and goals for treatment. It is developed by a registered nurse or healthcare team, and it is essential for guiding the caregiver in providing proper care. The nursing care plan includes assessments, interventions, and the expected outcomes. So that is the best documentation to obtain information about a client and the care that they need. Question 18. Gloves should be worn when in contact with the clients. A. Soiled linens. B. Bodily fluids. C. Open sores. D. All of the above. The answer here is definitely option D, all of the above. Gloves should be worn when in contact with the client's soiled linens in order to prevent exposure to potentially harmful substances or infectious materials. Also, Bodily fluids, which includes blood, saliva, urine, vomits, could contain pathogens that could lead to infection, so wearing gloves will help to protect both the personal support worker and the client. Gloves should be worn when in contact with the client's open sores in order to avoid contamination from bodily fluid or infection, especially when dealing with wounds or areas where the skin is broken. The use of gloves is a key part of universal precautions in infection control, and this involves protecting both the healthcare worker and the client from the risk of contamination and cross-infection. Question 19. When feeding a client, which of the following is the correct procedure? A. Engage the resident in a conversation while eating. B. The caregiver should feed the client as quickly as possible so the food does not get cold. C. A spoon should be used to feed the dependent resident. D. The resident's food should be mixed to enhance the taste. In option A, while it is important to engage with the resident, too much conversation while eating can distract the person and even cause choking or difficulty in swallowing. It is better to speak briefly between bites. For option B, rushing through the feeding process can cause discomfort and lead to choking or aspiration. So it is important to take the time for the resident to eat at their own pace. When assisting a client with feeding, especially those who are dependent, a spoon is typically the best tool. It allows for better control of the food and prevents the risk of aspiration. Additionally, feeding should be done slowly and thoughtfully, encouraging the patient or client to swallow properly. For option D, mixing food can make it more difficult to assess when the client is eating and might change the texture of food, making it harder for the person to swallow, especially for a client with difficulty in swallowing. So when feeding a client, the correct procedure is option C, using a spoon to feed the dependent residents. Question 20. What kind of vegetable do you like is an example of an open-ended question, true or false. We'll begin with true here. An open-ended question is one that encourages a more elaborate response rather than a simple yes or no answer. So a question like, what kind of vegetable do you like, is an open-ended question because it prompts the person to provide more details about their preferences, and they can go ahead to name various types of vegetables, their favorite types, and the reason behind their choice. Question 21. What is a trochanter rule? A snack served to residents. B. A rolled up towel or blanket to control external rotation of the hip. C. A bone in the body. D. A footboard. A trochanter roll is a supportive tool used in healthcare settings to maintain proper body alignment and to prevent external rotation of the hips in bedridden or immobile patients. It is made by rolling a towel or blanket into a firm cylindrical shape and placing it along the outer thigh from the hip to just above the knee. So that is what a trochanter roll is. It is used to control the external rotation of the hip. Question 22. What does the process of rehabilitation emphasize? A. Abilities. B. Limitations. C. Disability. D. New activities. Rehabilitation focuses on maximizing the individual's abilities and helping them regain or improve functional independence. Rehabilitation involves working on improving physical, emotional, and cognitive aspects of a person's health in order to enhance their quality of life and facilitate reintegration into daily activities and society. So the goal is to build on the abilities the individual still has rather than focusing solely on their limitations or disabilities. The rehabilitation process is often tailored to the individual's specific condition and needs, and it aims to restore independence as much as possible while promoting mental and physical well-being. Question 23. Which of the following is the most essential for life? A. Sexual stimulation. B. Oxygen. C. Water. D. Food. Oxygen is critical for cellular respiration, which is a process by which the body generates energy. Without oxygen, all those other options would not be possible. Without oxygen, the body cell would not be able to function, leading to death within minutes. While water is vital for survival and hydration, and as well as food, oxygen is the most immediately essential. Sexual stimulation is not essential for survival, although it can be important for emotional well-being, but the most essential for life is oxygen. Question 24. Which of the following is an example of supportive housing? A. Hospice care. B. Outreach apartments. C. Long-term care facility. D. Chronic care. Supportive housing is a type of housing that is designed for people who need assistance with daily living activities, but they do not require full-time medical care. It combines affordable housing with services such as personal care, meals, and medical support, and it also helps those with disabilities such as the elderly or individuals with chronic conditions. Hospice care is a form of care for individuals in the final stages of life, and it typically involves medical and emotional support rather than supportive housing. The long-term care facility provides residential care for people who cannot live independently due to medical or physical conditions. It is more of a care facility than supportive housing. Chronic care refers to medical care for individuals with long-term health conditions, but it does not fit the definition of supportive housing. Out of the options we have, the best that fits the definition of supportive housing is option B, the outreach apartments. Question 25. Good nutrition is needed for A. Growth, healing and maintenance of bodily functions. B. Maintaining body functions and decreasing peristalsis. C. Preventing disease and decreasing heartburn. D. Maintaining body temperature, sleep, and relaxation. For this, we'll be going with option A. Good nutrition is needed for growth, healing, and maintenance of bodily functions. Nutrients from food support the body's energy needs and helps to repair tissues, as well as ensuring that the body's system functions properly. This brings us to the end of the Module 7 video for the PSW NACC certification exam. Don't forget to like, comment, and share, and also hit the subscribe button so that you'll be notified when our next video will drop. Thank you for watching, and I'll see you in the next video.